I always thought that I have a healthy heart until one day when I was rushing to take a train. I feel that there's tightness in my heart, and I feel that I don't breathe normally. So I was a little bit worried, and I went to see a doctor, and the cardiologist said that I need to go to an angiogram.
Mr. Teo had a special X-ray. It's called a coronary angiogram. The way they do this is they shoot a colored solution via a very small tube that is placed in the origin of these coronary arteries. And this dye then flows down the coronary arteries, and then it will highlight where the narrowings or the blockages are. Now, Mr. Teo had quite significant coronary artery disease, meaning to say that there were quite a number of blockages and narrowings. In cases like Mr. Teo, when there are 3 vessels that are all narrowed significantly, the best option is, it has been shown from worldwide studies that the best option is coronary bypass surgery.
The doctor strongly recommended that I have to go for bypass surgery. I was definitely very scared and concerned because this involved opening the rib cage, and I was concerned in the sense that what there will be complication and what if I don't survive. Fortunately, the case manager and financial controller will be there to explain to me how I can use my MedicSafe and MedicShield to pay for my medical expenses.
My name is Nava. I'm the case manager for Mr. Teo. I was his contact person from the time he saw Prof. Michael and up to his discharge. And even now, after his discharge, I'm still his contact person. So I helped him in preparing for the surgery by advising him what are the precautions he should take, what are the medications he should avoid before surgery, as well as after surgery, how to take care of himself at home.
I was warded the night before because the surgery was scheduled at 9 a.m. That night, I must admit that I could not sleep soundly because there were concern, there were apprehension. I prayed and I was able to have a restful night. And the next morning, I woke up at 6 o'clock and I got myself changed and get ready for the surgery.
Coronary bypass surgery is a common procedure worldwide. We do it almost daily in our center. What we do is we take a segment of vein from either the thigh or the leg, or we take an artery that runs behind the chest wall on the left side, and we place it what we call downstream from the block. So this new segment of vein or artery provides the alternative route for blood to reach the heart muscle. Coronary bypass surgery is quite a complex procedure, and it's always possible to have complications like a stroke or a major wound infection. But for Mr. Teo's case, it went very well. We finished operation within 4.5 hours, and he had a very short hospital stay. And the last time we saw him, he has done quite well.
Our job starts when the patient comes to the ICU from the operating room. We make sure that we get a good handover to know the details of what operation has been done and what has happened in the operating room. Then we examine the patient, we make an assessment. Once the assessment is made, we then make a plan. The plan for the patient will have essentially 2 stages. The first stage would be to get the patient off the breathing machine. So for that, we make sure that we know how much of sedation the patient wants, how much of painkiller the patient wants, how much of fluids the patient wants. Some patients may need medications to support their blood pressure. So once that stage is over and the patient is out of the breathing machine, the next stage starts. That's where we get him ready for the ward. We make sure that he's able to eat and drink. We make sure that he doesn't lie in the bed because if you're going to lie in the bed for a long time, you're going to develop muscle stiffness and clots in the legs. So the physiotherapist then takes over. The physiotherapist makes sure that he's mobilized. Once everything is set in motion and we are confident that the patient can take care of himself in the ward, we make arrangements for the patient to be shifted to the ward. I mean, the ICU experience in essence is a team effort. It's a group of doctors, nurses, physiotherapists, respiratory therapists working towards the same goal, get the patient better.
After I stayed for 1.5 days in the intensive care unit, I was given the good news that I could be transferred to the general ward, where I could go through the complete recovery plan. The nurses and the doctors there, they were very helpful. They helped me to recover gradually. I spent 4 days in the general ward before I was allowed to go home. A whole team, including the RT, physiotherapists, nurses and doctors, helped with my recovery. One of the first things they did was help me get moving again. Because the sooner you can get out of bed, the sooner you can go home. They also give me a lot of helpful tips about exercise and diet and other things to do at home to get back to good health. It has been 2 weeks after my bypass, but it's going to take about 2 to 3 months for my complete recovery. But I find that my small win in the success operations from the surgery would bring about a big victory in that I'm going to have a healthier heart in time to come, and this will ensure that I'm going to live healthily and to live longer.